What if you could save your life by identifying these symptoms? Today, I'm going to share 15 important indicators that you may be missing in your everyday life that could point to cancer. Since many diseases, such as brain or pancreatic cancer, don't exhibit signs until it's too late, recognizing these symptoms isn't always simple. Knowing these symptoms is crucial because of this. The likelihood of successful therapy for cancer increases with early detection. You're probably thinking that any minor discomfort could be cancer. I might get anxious if I do an internet search. This is precisely the reason this video is unique. We'll concentrate on warning indicators supported by science rather than online gossip. Thousands of people have been able to detect cancer early when treatment is most effective, thanks to these similar indicators. Let's get started now. 1. Persistent fatigue. Have you recently experienced particularly high levels of fatigue? One of the first indications that cancer is developing in your body may be chronic weariness. It's time to take attention if you find that your energy levels have drastically decreased and that neither sleep nor rest seems to be helping. This is a profound, persistent lethargy, not the typical fatigue from a hectic day. This weariness may be especially suggestive of malignancies such as lymphoma or leukemia. These tumors interfere with your body's ability to make healthy blood cells by affecting the bone marrow and blood. As a result, no matter how hard you attempt to rest, you feel exhausted. Along with exhaustion, you may also feel disoriented or have weak muscles. These symptoms may be associated with tumors like stomach or colon cancer that affect hormone levels or cause internal bleeding. Cancer can cause persistent fatigue and other associated symptoms when it interferes with your body's regular processes. The problematic issue is that chronic weariness is frequently confused with stress or excessive workload. However, it's imperative that you see a doctor if you have particularly high levels of fatigue over a lengthy period of time. They are able to carry out the required tests to ascertain whether an underlying problem requires attention. 2. Persistent headache. Are you experiencing a persistent headache? It can be concerning when a headache persists even after taking prescription or over-the-counter medicine. See a doctor if you have a headache that doesn't go away after more than 2 weeks. A brain tumor or other brain tumors could be the cause of this kind of headache, which could be an indication of something more serious. The headache itself may be accompanied by further neurological symptoms. These could include drooping of the face, abnormalities in hearing, or double or blurred eyesight. You should get checked out right away if you have a chronic headache and any of these symptoms. A medical expert should also assess seizures or other odd neurological occurrences. These signs may point to brain abnormalities that require urgent care. These kinds of symptoms can result from brain tumors that strain on nerves and interfere with regular brain function. It can be risky to ignore a chronic headache and its accompanying symptoms. Even though not all headaches are caused by cancer, those that persist for a long time and don't improve with standard therapies should be carefully examined. Treatment and management of brain tumors and other related diseases can be greatly improved by early identification. Pay attention to your body's signals and know when something is off. Do not put off getting medical attention if you have a persistent headache accompanied by other neurological problems. Being careful and making sure you get the right care is always preferable. 3. Body rash. Certain rashes require prompt medical treatment when it comes to skin changes. The characteristic skin symptoms of leukemia, a malignancy that affects blood-forming tissues, are sometimes misdiagnosed as lesser ailments. The main distinction is in the appearance and behavior of these rashes. A typical characteristic of leukemia is platelet insufficiency, which causes petechiae, which are small, round spots that develop on the skin. When you press on these spots, which usually measure 1 to 2 millimeters, they don't blanch or fade. They can be red, purple, or brown, and they frequently group together around tight clothes or in places where pressure is applied, such the ankles. It is essential to comprehend the mechanism underlying these spots. The production of healthy platelets, which typically aid in halting bleeding, is interfered with by leukemia. These distinctive patches can result from capillaries, which are microscopic blood vessels that bleed when platelets are insufficient. Leukemic rashes last longer than ordinary rashes, which may itchy or go away after a few days. They can also be accompanied by other symptoms, such as bleeding or unexplained bruises. It's critical to get medical help if you observe these rashes or encounter these extra symptoms. 4. Changes in urinary or bowel habits. Have your recent restroom habits changed in any way? An early indication that something is wrong with your body could be changes in your bowel or urine habits. You should consult a physician if your diarrhea or constipation persist for several weeks. Although these symptoms may appear to be trivial, they may be a sign of cancer or other dangerous underlying diseases. Changes in bowel habits may indicate Crohn's disease or another inflammatory bowel disease, but they might also be an indication of stomach or colon cancer. Your ability to go to the bathroom frequently and comfortably may vary noticeably as a result of digestive system abnormalities brought on by certain cancers. Urinary tract problems may also be indicated by changes in urination, such as pain during urination, increased frequency, or a weak stream. These signs could be a urinary tract infection, an enlarged prostate, or more dangerously, malignancies of the bladder or prostate. It is imperative that you have them checked if you observe these changes. These symptoms may be early indicators of cancer, although they can also be brought on by less serious illnesses. Investigating and ruling out significant disorders is always preferable to ignoring symptoms and running the risk of a possibly treatable condition getting worse. Being aware of your body's cues is a key component of taking charge of your health. See a healthcare professional if you notice any ongoing changes in your bowel or urine habits. For diseases like bladder, prostate, stomach, and colon cancers, early detection and treatment can greatly improve results. 5. Persistent heartburn. Gastroesophageal reflux disease, GERD, the official term for chronic heartburn, may seem like a little annoyance, but if it continues after medication and lifestyle modifications, it may be an indication of something more serious. The initial symptom of esophageal cancer is frequently chronic acid reflux that is unresponsive to standard therapy. The recurring harm to your esophageal lining is the link between malignancy and chronic heartburn. Barrett's esophagus is a disorder that can develop over time as a result of changes in the cells lining your esophagus brought on by stomach acid. Your chance of esophageal adenocarcinoma is greatly increased by this precancerous condition. In addition to your heartburn, keep an eye out for warning signals such as trouble swallowing, food being stuck, or unexpected weight loss. It's time to see a doctor if you have been using over-the-counter drugs to manage your heartburn for longer than 3 weeks without seeing any change. 6. Mouth sores that won't heal. Have you ever had mouth sores that are stubborn? It's important to consider seriously mouth sores that don't go away in a few weeks. Oral cancer may be indicated by persistent sores, lesions, or white patches on your lips, tongue, gums, or other oral tissues. Any area of the mouth, including the lips, tongue, and throat, may develop this malignancy. You are more vulnerable if you smoke or drink excessively. Concern should also be raised by symptoms like trouble swallowing or inexplicable weight loss. Leukoplakia, or white spots, can be a precancerous condition that, if untreated, can progress to malignancy. If sores don't heal, get medical help right away because early discovery is essential to effective treatment. 7. Blood in the urine or stool. Blood in your stool or urine might be concerning, therefore you should never disregard it. Blood in the urine might be pink, red, or dark brown, while blood in the stool can be black, tarry, or scarlet. These signs could point to cancer or other dangerous illnesses. Blood in the stool may indicate inflammatory bowel disease or tumors of the digestive tract, such as colon or rectal cancer. Urinary tract problems or prostate or bladder cancer may be indicated by blood in the urine. A medical expert should assess these warning indicators right away. To identify the underlying reason and obtain the right treatment, prompt examination is essential. 8. Cough or hoarseness that won't go away. A doctor should be consulted if a cough or hoarseness persists for more than 2 weeks. Lung cancer may be the cause of a persistent, dry, hacking cough. Coughing up blood or a bloody discharge is especially dangerous and has to be treated right once. Thyroid or throat malignancies may also be indicated by hoarseness or a strained voice that doesn't go away. Despite being frequently disregarded, persistent coughing and hoarseness may indicate more serious diseases. Don't disregard these symptoms. Get evaluated by a medical professional. 9. Excessive bruising. Any sudden appearance of bruises may indicate the presence of blood malignancies like leukemia. A doctor should be seen if you have unexplained bruises in odd locations on your body. It's also important to pay attention to other indications of blood abnormalities, such bleeding gums or frequent nosebleeds. Since these symptoms may point to serious disorders, early detection is essential. 10. Eye pain. Important details about your general health, including possible cancer symptoms, can be gleaned from your eyes. The most prevalent primary eye cancer in adults is ocular melanoma, notwithstanding its rarity. Symptoms may include flashes of light that sufferers cannot explain, or impaired vision that may not better with new glasses. Another red flag is a dark patch on the iris that varies in size or hue. You may be more susceptible to ocular melanoma if you have fair skin or lighter-colored eyes. Never disregard ongoing eye pain or changes in vision. Your life and your vision can be saved with early intervention. If you have a family history of eye cancer or other risk factors, such as extended sun exposure, it is extremely crucial to undergo regular eye checkups. Thank you for watching. Remember, your health is your most valuable asset, and it's essential to pay attention to the warning signs your body gives you. If you notice any of the symptoms we discussed, don't wait. Seek medical advice promptly. Early detection can make a significant difference in your treatment and outcomes. Be proactive about your health, stay informed, and take care of yourself. If you found this video helpful, be sure to like, share, and subscribe for more health tips and important information. Stay healthy, stay safe, and see you in the next video.